an update. As the chair indicated, unfortunately, even 2 years into this post, we're still talking about COVID and where it sits currently. And this first slide is something we've been using for quite some time, is examining the COVID levels in wastewater. Since there's a limited availability of testing and individuals' access to testing, this is right now one of the main indicators we look at to get an idea of what is happening in our community and what possibly is going to be coming to the hospital. And as you could tell, this is the provincial signals, and wave 5 is the bigger bump there in the middle of December all the way till February. And then we had the lull, and then unfortunately COVID numbers in wastewater are increasing. This is the provincial signal, which the Ontario Science Table now posts on their website, and they have issued a publication which supports the concept of tracking wastewater as an indicator of the level of COVID in particular communities. If you look at how it's broken down between the various jurisdictions, regions across Ontario, you will note for us, what would be counted as the Southwest is our numbers actually are not what is driving the previous data. Is you look at the GTA, Eastern, and Central is driving the numbers even more so than what we are when it comes to levels in our region. So that's technically not good news for our region in the sense of a possibility that there is more to come. If we follow suit of the other regions and where they're heading, is we could be just at, quote, the start of this wave. I was shared this by Dr. McKay today, and what it shows is the rapid increase in Windsor-Essex, and this is all of the surveillance of the testing in Windsor-Essex wastewater, and you could see it's pretty much a straight line with respect to COVID being detected in the water levels. Generally, you're looking at about a 1 to 2 week gap between seeing this and what we see in the hospital. Is we're always a lagging indicator. So this, of course, starts lining up with cases in the community, but we don't start seeing those individuals come to the hospital until 1 or 2 weeks post these numbers start going up. So again, consistent with what I just outlined previously, is unfortunately the worst of what's possibly going to happen in wave 6 is yet to be seen in Windsor-Essex and in the hospitals. Now, again, this is something nobody wants to hear. I don't want to hear about it. I don't even want to talk about it. But we have an obligation to share this information with everyone. And we don't want to raise this as a crisis or as, you know, this is a massive problem. We don't know yet, but things are not tracking in the direction we want them to be tracking. Now, is this what is, quote, expected? Is in the sense of with the drop of the mandates, the opening up of everything, were we expecting a bump? Yes, no doubt about it. The issue, though, is it trending higher than what was expected or what the system can tolerate? And that is what's left to be seen. You don't have to look far with respect to what's happening in the UK. China's a little more difficult to get information from, other than they're pretty much shut down Shanghai and are testing individuals on multiple days, but are shut down in between. So Our concern is where this is heading. Again, we definitely have not seen the worst part of this yet based upon this data. And we see it with respect to the volume of patients that are coming to the hospital with COVID already, and some of those that are being admitted to the hospital. So if you look at a provincial scan of hospitalizations, you can see, again, consistent with the wastewater data, it's the peak. If you remember, the wastewater slide showed more in the middle of December, the wastewater going up. Hospitalizations followed suit closer to the end of December provincially, and then went up. So again, about a 2-week lag. And then as wastewater descended, so did the hospitalization cases. But unfortunately, we're looking at here is a increase once again. Now, again, we're nowhere near what it was in wave 5. But it again is increasing, and it's left to be seen. Will it get to the level of wave 5? We don't know. Hopefully it doesn't. Hopefully it's able to plateau because of the vaccination rates, because of other factors, but it's left to be seen how it goes. If we look, this is just our own data here at Windsor Regional Hospital. Again, similar to, this is our hospitalization rates just at our hospital alone. And again, sorry, I didn't put the axis on the side with respect to numbers. But if you see, again, similar to what was going on in the province, is we started seeing an increase at the end of December. Its peak in the middle of January to the end of January, dropping back down, and now a gradual increase in the hospitalizations at the hospital with COVID-19. And that is now, today, I think the number was 41 of patients in the hospital with COVID, and about 3/4 of them are directly related to being admitted because of COVID, versus those who are in the hospital who happen to have COVID, but possibly are here with something else and being treated for something else. The good part about it, again, because of the hospital, because of the high vaccination rates, our ICU admissions still are lower. Again, it's still a lagging indicator, but they are holding okay. I think they're 1 today. But again, that happens to be still working with respect to the vaccination rates and the other measures we're taking at the hospital. So before I jump into the next topic I wanted to talk about, which was the new hospital planning, I wanted to hand it over to Dr. Saad, because there's been a lot of discussion. First of all, if he has anything to comment about what I just said. And then second of all, to talk about this discussion, there's been a lot of attention to a new subvariant called XE, and for Dr. Saad to talk about that. So I'll hand it over to Dr. Saad.
Thank you, David. No, I don't have anything else to add to what you said. I think it's very important in this era of lack of accessibility for testing that we rely on some other measure to know what's happening in the community. Because as you said, hospital admissions and ICU admissions are lagging indicators. And if we wait for those numbers to go up, we've clearly missed the boat in terms of what's going on in the community. And there was a recent estimate that based just on the wastewater data, that there are close to 100,000 new infections in Ontario per day, which would be the highest number that we're seeing since the beginning of the pandemic. So yes, we're not in a crisis situation yet, but we're definitely headed with those numbers to something that could potentially overwhelm our healthcare resources. The XE subvariant, what XE actually is not an individual variant, just like BA1 and BA2 were. What it is it's a recombinant virus, and it's a recombinant virus of the BA1 and the BA2. So what happens is when somebody's infected with BA1 and BA1 is spreading across the globe, then you have another variant, BA2, which then starts to spread across the globe. One tries to take over the other based on how transmissible it is. And what you run into are situations where people become infected with both. So they'll have both BA1 and BA2 in their body at the same time, and the viruses will then swap genetic material. So as we all know, coronavirus is an RNA virus, and those viruses can then share genetic material and lead to a new virus, and that's called a recombinant virus. If this is not the first time this has happened with coronavirus, by the way, this is now the fourth or fifth recombinant variant we've seen. There are others that were named XD and XF. There was one between Delta and Omicron that some people labeled Deltacron. But this XE is a combination of BA1, BA2. It's too soon to tell whether it's more infectious than either of the subvariants right now. But it's always something that infectious disease experts and epidemiologists are concerned about, because what we don't want to see is a variant or a recombinant virus that all of a sudden is more contagious than Omicron, but as lethal as Delta. That would probably be the worst scenario in terms of an increase in spread and hospitalizations. So thankfully for now, it's just as infectious and contagious as the BA2 variant, not as severe in terms of overall mortality. And it seems to cause similar symptoms as Omicron, which, as we all know, is more cold-like symptoms. You don't get the same loss of taste and smell. It's a lot of runny nose, cough, and myalgias. So for now, it's still, we're still looking at it, and nothing to be overly concerned about, but definitely on the radar. And of course, with less vaccinations and less people following public health measures, you're naturally going to get more of these potential recombinant viruses and or new variants arising. So we always have to be cognizant of that. Thanks, David.
All right. Thank you, Dr. Saad. So now I will shift gears and talk about the new Windsor-Essex Acute Care Hospital project and just give a brief update regarding some of the community engagement which focused on some town halls. So just some background is we started the platform in March, and the goal of the project was to share highlights from the 11 key functional areas. We introduced the community to individuals leading each of the functional programs, and we provided an opportunity for questions and meaningful input at an early stage of planning with respect to the process. And this slide off to the side is the Together We Build website that individuals can access to get all the information with respect to the various town halls on these key areas as indicated. Visitors, again, have had an opportunity, if you go to togetherwebuild.wrh.on.ca, is you can subscribe to the mailing list. You can, if you were not able to attend an actual town hall, is you can watch the replays of the town halls that are there. And also there's various surveys asking for feedback that you can participate in. So far, just in the last months, it's been launched. We've had over 2,500 people visit the site. 11 town halls have been held. Approximately 350 people attended live. We received close to 500 views on YouTube. 45 members of the planning team and user groups have participated, plus, which is unique to our situation, which we added is having patient representatives on each of the groups. During the town halls alone, 100 questions have been answered, and another 19 that were given on the project site. And there's been 240 surveys have been completed, 46 ideas shared. So it's a very robust community engagement portion of the project, which technically has just started. So pretty large numbers, considering we've only been at this for a month with respect to this process, but we really appreciate the community's involvement and engagement to date. And the game plan is there'll be another round of town halls later on that we will be updating with respect to the status and bringing everybody up to date. But we still continue to ask people to attend the website, participate. This is your hospital. This is your future. It's going to move along pretty quick, folks. This is going to keep trucking along. So we really have to, as we've always stated, this is where the rubber hits the road with respect to planning. And it's pretty exciting with respect to some of the feedback we've received so far and what we look forward to moving forward in the future. So, Mr. Chair, that is my report, subject to any questions.
Great, thanks, David. Does anyone have any questions for David or Dr. Sad? Lori?
Just, last time we had one of these waves, we had a lot of staff that were infected. Are we seeing the same thing happening again with this wave?
Yeah, not anywhere near the previous wave, but yes, our staff are no different than the community. And we started seeing the numbers go up with respect to staff. Technically, similar to what is being experienced in the community. And that's one of the indicators we know something is coming when we see staff numbers starting to go up a bit. So yes, but nowhere near the last wave. So again, it's early. When we do the May meeting, we're going to know. So in the next 4 weeks, we'll know what hit us.
And my other question is, this increase, has it changed our plans about catching up on those surgeries?
Well, I think Karen's going to speak about that a little bit in her report, but definitely it is pressure to the system. So, I mean, right now we're north of 100% when it comes to census, and that's when we include the surge beds that the government supported us bringing on for quite some time. So that is a struggle. So we're trying to balance all the balls in the air at the same time. As I stated, we have 41 inpatients who have COVID. We have approximately another 10 to 15 who are recovering from COVID, who are still in hospital, but are not considered, they're in their recovery phase of COVID. So when, arguably 10% of your inpatient beds or even greater, if you look at med surge beds, are occupied by patients that typically would not be here in a pre-COVID year, that puts a strain on the system at a time in April when generally we're very busy to begin with at this time of the year. So it just adds to that. So as the COVID numbers increase, that creates pressure on the system for us to keep up and try to do the surgeries and try to make up the wait time. But I can tell you last month, I know it was reported our wait list sat at about 5,200 patients. Rosemary confirmed that as of March 31st, that number has dropped down to under 4,100. So we're making some progress. We'll be able to sustain it. That's unfortunately left to be seen. So hopefully that answers the question. The team's doing the best they can. They're really, it's a lot of balls in the air. How about that? Karen, do you want to add anything?
No, I was going to say I can delete a couple of slides for my presentation now. I think you covered it all.
Rosemary, do you want to add anything? Did I miss anything?
No, it's a lot of our issues are health human resources, not having enough anesthesia, and they are, believe it or not, are human too, and they're getting COVID, and it's unexpected, and all of a sudden they're off 10, 14 days. So it's not only scheduling the surgeries, but surgeries are being canceled. So.
And we're not alone. Like, this is not a Windsor Essex issue. This is a systems issue. And, there was some, media attention to OMA, and they're trying to advocate the best they can with respect to percentages of wait time, et cetera. But, when you look at the actual raw individuals waiting, it's different as compared to percentages of wait time. So it's a different way of looking at it. So it's, it's a struggle for all of us. But I know, locally, regionally, provincially, everyone's trying to work together and coming up with various solutions on try to get the wait time down and get those surgeries done. But there's a lot of other stuff going on too. We're trying to get done simultaneously as well.
Any other questions for David? All right, thank you.